I was a PhD student at Imperial College London as we first had iFR available for clinical use. I was involved in the very first clinical case and then involved in developing and designing the landmark clinical trial, the DEFINE FLARE trial. I was involved in recruiting patients at Imperial and also in training sites all over the world, and it's really been part of my journey in my academic career. As part of my academic career, what I've really learned, primarily out of the iFR journey, is the importance of collaborations between academic institutions, interventional cardiologists and industry. And actually, as part of that partnership, we've been involved in training and education, clinical trial development, and it's really been a fantastic partnership that's allowed growth for both sides actually, and for the implementation of a new technology that's been really important for patients. For interventional cardiologists, what really matters is clinical data. It's the data that counts, and it's only once we have clinical outcome data that we are really convinced that it's time to use a new technology for our patients. So I think once we had the data from DEFINE FLARE and from iFR Sweetheart, we were able to be happy that iFR was non-inferior to FFR in terms of clinical outcomes. And then I think it really made an impact on the application of iFR across the world. People were convinced that this was a technology they could use, they could trust what it would do for their patients, and they would trust the safety of this technology for their patients. And I think from then on, iFR started to be rolled out all over the world.